Hello, National Academy of Hypothyroidism. It's Dr. Nancy Evans here from Holtorf Medical Group, ready to answer your questions of the week. So we have 4 of them today. The first one is from Susan Kane. Hello, Susan. She asks, why are so many doctors so ignorant about the facts of low thyroidism and Hashimoto's? And she said she feels like she knows more than some of the medical professionals out there, and she's suffering. So the good news is that you as a lay person are getting educated. There is so much great information out there. So get as much information as you can. Learn what blood tests to request from your doctor. You want to get a full thyroid panel, TSH, free T4, free T3, reverse T3, and the 2 antibodies, which are anti-thyroid peroxidase enzyme and the anti-thyroglobulin antibody. So this will really help for you to get a full diagnosis, to come armed with some information to your doctor. If they don't understand these concepts, then it's not a doctor that you want to see. And then as far as explaining why is it that doctors seem to be ignorant, our education is focused, unfortunately, it's become focused on just keeping people inside the normal ranges. And lab ranges, this is the way the industry works. When a lab takes in all their samples, they take the mean plus 2 standard deviations away, so they have to include 95% of the population as normal. So they're only going to treat you if you fall in the bottom 2.5% or the top 2.5% of the population. That is like saying we're only going to remark on you if you're an A+ or an F, but if you've slid from an A- down to a D, we say you're normal. So that's what the industry is all about. It doesn't mean that we can interpret them differently. So a good doctor will look at optimal values for you, shooting for at least the upper half of these normal ranges. Many of you are quite symptomatic, even though your thyroid levels are within the normal range. Now, you did ask about Hashimoto's, so make sure that's the autoimmune thyroiditis. Make sure you get those 2 antibodies checked. And often a thyroid ultrasound will also put everything together along with some in-house testing, Thyroflex, BMR, and a urine iodine test. So you want to be armed with as much information as you can. Bring that to your doctor and just see if they are open to it, and then you together can work on a good diagnosis and treatment plan. So just keep looking for somebody. There's some great doctors out there, and I'm sure you'll find somebody to work with you. Take care, Susan. Hello, this is question number 2 from Betsy Perkins. Hello, Betsy. She said she's taking 150 micrograms of levothyroxine, so that's T4, that's the generic form of Synthroid, and she's also been on low estrogen, which is a birth control pill. She's feeling better on that. That's great, right? T4 works great on a lot of people. Don't be afraid of it. We usually don't prescribe it first right off the bat, but there are thousands of people in there for whom it works. So it's a fine molecular structure. It's a fine medication to be on for some people. So I'm glad you're feeling better. She says she was just told she has kidney stones. So could one of these be causing it? I don't think there's a correlation between the birth control pill directly to kidney stones, but the birth control pill can deplete your body of B vitamins. I don't think it can deplete it of magnesium, but here's what you want to do with kidneys to prevent kidney stones is you want to make sure you've got some B6 on board. So take a good full B complex. And then you want to make sure that you're taking some magnesium. Magnesium will bind with the oxalates so that you aren't forming stones. Magnesium, a citrate is a good form. If you have any tendency towards constipation, then magnesium citrate can be helpful. If you get loose stools, you're going to have to back off a little bit. But try to get up to 600 to 800 milligrams of magnesium can help prevent those stones, along with B6. Usually, I believe it's 50 milligrams that you'll want to be on. She was also on some surgery, and could stress and diet be a factor? Certainly. That can if you've had surgery, any major stressor, it can lower your thyroid function, so you might need some more thyroid medication, but it sounds like you were feeling better except for these kidney stones. So add in your magnesium, add in the B6, and then also if you're taking vitamin D, let's get some D and K in there, because K will make sure that the K and the D together will make sure that we're driving your calcium into the bones rather than having it hover around the blood to form those stones in the kidneys. But if you have to have them laser surgically removed, or obviously it's a very painful process. But usually increasing green vegetables has a lot of magnesium in it too. So you should be able to prevent those. If you find that it's not working, you might have to switch birth control pills. Okay, take care, Betsy. Okay, question number 3 from Laura C. And she says she's only on desiccated thyroid, which is IRFA in her case, nature thyroid or Armour. So this is a porcine animal, pig-based thyroid. It's a great formula. It's T4 to T3 in the same ratio that our body makes. She said that her free T4 levels are off the chart low, and she wants to bump those levels up. So can she take some levothyroxine in the morning and substitute part of her dose, and how should she do this? And her doctor seems to be a little bit unsure. Instead of adding in T4 or levothyroxine, I would increase your IRFA dose, so that natural desiccated thyroid. That has some T4 and some T3. If we are aiming too much for just your T4 levels, often it gets stuck there and it does not convert. You don't have the right enzyme to convert T4 to T3, which is the active hormone that then goes into the blood and turns on all the cells. So you want to have a good ratio of T4 to T3 to prevent a lot of that reverse T3 blockage. Reverse T3 is like putting a foot on the brake while you're trying to put a foot on the accelerator. So Laura, you probably can just raise that dose with your doctor's help. And you didn't mention what dose you're on, so go up to the next dose. If you're on a half a grain, go up to 3/4 of a grain, or probably you can go up more than that. You can go up to a full grain if you said your free T4 levels are off the chart low. What we're really concerned about, though, are your free T3 levels. We want to get those in the mid-range. Free T4, I'm shooting now for just as long, sort of low, mid-range, normal. I want the free T3 to be up in the mid-range and higher. And then make sure your reverse T3 is not too high. We want a good ratio of free T3, that's the foot on the accelerator, to reverse T3, which is a foot, like having a foot on the brakes. We want that 0.2 to a 1 ratio. So in other words, take your free T3 levels, say it's 2.3, take out the decimal points, you've got 23. Look at your reverse T3 levels. If they're 11, that's pretty good. You've got 23 to 11, that's about a 2 to 1 ratio. It means that you're probably converting your T4 to T3 nicely. So you should be able to just increase your dose, watch your clinical benefits. Are you feeling a little bit more energy? Make sure you don't have any increased heart rate, palpitations, jitteriness, insomnia. If you have any of those at all in these increases, stop it entirely for a couple days, get it out of your system, and then go back to the prior dose. All of this working with your doctor, you should be able to get your levels up. Okay, take care, Laura. Thank you. Okay, question number 4 is from Dina J. Birch. Dina, you've asked a lot of questions. I may not get to all of them, but I'm going to get through most of them. I think this will give you a nice, good start, and might help some other people who have similar questions. So she loves her endocrinologist, which is great, and she wants to make sure that her endocrinologist orders the right test. And she has autoimmune Hashimoto's thyroiditis. So the most important is to get that full thyroid panel: TSH, free T4, free T3, reverse T3, anti-thyroid peroxidase enzyme, sometimes it'll just say TPO, and anti-thyroglobulin antibody. Sometimes it just says thyroglobulin AB. So that's the full blood panel to really check your thyroid function. Sometimes we'll include a few other ones, like if you're still menstruating, we want to see your serum iron and ferritin levels, as well as sex hormone binding globulin. Those are some indirect markers. Your endocrinologist might not know how to work with them. Even without them, you'll do fine. So if your antibodies are high, one of the best treatments for treating Hashimoto's is low-dose naltrexone. There's some great research out there. Look on ldnresearch.org, I believe it's called. Some really good research. It lowers the antibodies in just about everybody. It's a fantastic way to reset the immune system if you've got Hashimoto's. She wants to know about some other tests. She says her endocrinologist checks her CBC, or comprehensive metabolic, and cholesterol. Interestingly enough, high cholesterol is also a sign of hypothyroidism. This is not new research. This is in the basic endocrinology textbook that's 20, 30 years old. So this is not new news. Hypothyroidism can cause elevated cholesterol. So always work on that issue first before you consider statins. And I agree, is that for a woman, you should probably most likely not be on a statin. There's very little evidence that they're helpful. You also checked your hemoglobin A1C. You're talking about blood sugar. This is a great test because it does check your average blood sugar over a 90-day period. So this will tell us better than just your fasting blood sugar whether you're headed towards insulin resistance or diabetes. We want that number under 5.7. Now, the great thing about this test is your body just tells us, can it handle carbohydrates very well? And if your number's high, it means your body is talking to us. It does not handle carbohydrates well. You need to be more on a paleo-type diet, a good amount of protein, a great amount of fats, lots of vegetables, just eliminating the carbohydrates like pasta, breads, crackers, cookies, and of course any of the simple sugars and juices and things like that. So that's very important. You're talking about your weight, so you need to manage your blood sugar. So I like the fact that your endocrinologist is also working on these different issues with you. You also were told that your thyroid has shrunk since you've been on your levothyroxine. This is not uncommon, especially in the case of Hashimoto's. Usually it's enlarged, that the gland is trying to function, so it gets enlarged and it creates this abnormal cellular function. So if we can stop any of that excess growth with appropriate thyroid medication, it's usually a pretty good sign. It will shrink sometimes. It means it's not functioning very well anyway, so it does mean that it's not going to function any better on medication. So your medication is neither going to increase your thyroid's production, nor is it going to suppress it. It's just going to add to the production that you're already doing. Most of us and most of you who are asking these questions, your thyroid's not working that well anyway, so let's go ahead and fill up the tank with your with the medication and get your thyroid levels on board so that they can turn on all the cells in your body. It sounded like you're doing pretty well on the dose you're on. You said you're on T4, 112 micrograms. Your weight had gone up. If you're able on a healthy diet, you said you're taking a supplement regimen. It sounds like it's a shake protocol. You mentioned a brand name. If you're taking that and you're able to lose weight on it, then your thyroid's probably pretty well managed. If you're pretty stuck, while on a great healthy diet, minimal carbohydrates, and nothing's moving, and you have other symptoms like hair loss, dry skin, constipation, fatigue, depression, then your thyroid dose might not be optimal. And that's where that full blood panel will help us determine whether you're on the right dose or not. And you also mentioned food allergens. It's a great way to start eliminating those that cause inflammation, they cause weight gain, especially that sort of puffiness, edema that contributes to weight gain. So I like the approach you're taking. Even though the thyroid goes into the nucleus of every cell in the body and it's a major driver to our health, we have to look at, we call it sort of the full wheel of health. We want to look at our blood sugar, we want to look at our hormones, we want to look at our adrenals, we want to look at our diet, exercise, stressors, we want to see if we're living out our right purpose, and all that must come together if you're going to achieve optimal health. Looks like you're on a great path towards that, Dina. So good luck to you. Take care, everybody. We'll talk to you in 2 weeks. Go ahead and submit your questions, and I'll be ready to answer them for you. Take care.